In 2015, Pennsylvania Governor Tom Wolf nominated Admiral Levine to be Pennsylvania's Physician General, and she was subsequently unanimously confirmed by the Pennsylvania State Senate. In March 2018, Admiral Levine was named Pennsylvania's Secretary of Health. During her time in state government, Admiral Levine worked to address Pennsylvania's opioid crisis, focus attention on maternal health, and improve immunization rates among children. Her decision to issue a standing order for the anti-overdose drug naloxone saved thousands of lives by allowing law enforcement to carry the drug and Pennsylvania to purchase it without a prescription from their doctor. Admiral Levine is a fellow of the American Academy of Pediatrics, the Society for Adolescent Health and Medicine, and the Academy of Eating Disorders. She was also the president of the Association for State and Territorial Health Officials. In addition to her recent post in medicine and government, Admiral Levine is an accomplished speaker and author of numerous publications on the opioid crisis, adolescent medicine, eating disorders, and LGBTQ medicine. So without further ado, I'd like to introduce Admiral Levine, and then after the Admiral's discussion, we're going to have a faculty and student panel, and then we'll answer some questions from the audience. All right? Thank you very much.
Thank you. Thank you so much. Well, thank you, Professor Gomez, for that kind introduction. And really, thank you so much for your very warm welcome. I am just very pleased to be here at Lehigh University. I'm pleased to be back in Pennsylvania and to see you all. And it's particularly a pleasure to join you for this inaugural event to formally introduce the Institute of Health Policy and Politics at Lehigh University. I have no doubt that this institute will cultivate some of the best healthcare policymakers in Pennsylvania and across the country and throughout the world. So I look forward to all of your great work to come, and then when you're ready, we'll hire you. The timing for this institute could not be better. COVID-19 has clearly been the biggest public health crisis that our country and the world has faced in over 100 years, and it has been taxing, physically taxing and mentally taxing, especially among our country's most vulnerable populations. But we have all felt the strain. Tried to draw some lessons from the pandemic, and I think one important lesson is that we are all interconnected. The decisions that each one of us make, each one of us personally make, influences not only our own health, but the health of our families, the health of our communities, the health of our nation, and literally the health of the world. Despite the heavy toll it has exacted, COVID has also reminded us of a fundamental truth, that we need each other, that our happiness, but really our very survival, is dependent upon our connections to one another and to our community. That spirit of community is truly what makes our country great, and it is what we need now more than ever as we seek to put an end to the COVID-19 pandemic. Another important lesson is the profound importance of public health. Public health has really shown itself to be so important at all levels, and we must ensure that local, state, federal, and international public health authorities have the resources, the workforce, and the IT capabilities that are needed to protect the health of our nation and the world as we move forward. The pandemic has hit us hard throughout our nation and the world, but we now do know what we need to keep ourselves, our loved ones, and our communities safe. And so another lesson of the pandemic is the profound health disparities that exist in our nation. COVID-19 has shown us the depth and the breadth of the health disparities that we have in our nation, and the critical importance of health equity, diversity, equity, and inclusion. And that is particularly true for traditionally disadvantaged communities, the African American community, the Latino community, the American Indian Native Alaskan community, the AAPI community, other communities as well, the LGBTQI+ community. So those health disparities are something that we have to work to address, and COVID-19 has shown us like nothing else. So it's time to focus on what we can do, and what we can do in addition to tackling the pandemic is to prepare for future and deal with future public health challenges. One area that maybe you all can help us on in this institute is the challenges of health misinformation. Misinformation for health issues is not just a COVID-19 issue. It really threatens our ability to address current and future pandemics and other health challenges. Our health as individuals and as a society depends upon having accurate information from sources that we trust and that use the best scientific evidence that is possible. During COVID-19, people have been exposed to an abundance of information from a large number of sources. And while the large volume and steady flow of information from credible sources has enabled people to stay safe and informed, it also has led to confusion. So, for example, as scientific knowledge about COVID-19 evolved, remember this was, and I said this when I was Secretary of Health of Pennsylvania, this was a novel coronavirus. This was a new virus that we knew absolutely nothing about. So as we have learned so much over the last more than 2 years about this, that has led to changes in public health recommendations. As we had new information, our public health recommendations changed and evolved, as it should. It is essential to the scientific process that we update assessments and recommendations based on new evidence. But without sufficient communication that is clear and concise, people have trouble figuring out what to believe, what sources to trust, how to keep up. Amidst all this information, unfortunately, many people have been exposed to health misinformation. Health misinformation has clearly undermined many of our efforts about COVID-19, including our vaccination efforts. During the pandemic, health misinformation has caused confusion. It has created mistrust. It has literally harmed people's health and has weakened our public health efforts at all levels. According to the Kaiser Family Foundation, belief in pandemic-related misinformation is widespread, with 78% of adults saying that they have heard at least one of 8 different false statements about COVID-19 that actually they either believe to be true or they're unsure if it's true or false. An analysis of millions of social media posts found that false stories were actually 70% more likely to be shared on social media than true stories. In some cases, health information has led to death threats and violence against health workers, against public health workers. It has divided friends, families, and communities. By making it harder for us to distinguish what is true and what is false, health misinformation prevents us from taking care of ourselves and our families. It undermines our ability to take care of one another and our communities. We must each raise our personal bars for what we share online and offline. Everyone has a platform, so we need all of your help. Everyone has a platform, whether it's your home, your community, at your school, at your job, online. And so we have, I believe, a collective moral responsibility to be honest, to be fair, and to be accountable for what we say in all of those different settings. Now, I've talked about public health issues and public health policy. We must continue to invest in growing our nation's public health workforce today to better meet our needs today and, of course, our needs tomorrow. As we work to expand talent, including at this new institute, whether it's in the field of health education, health communications, public policy, public health informatics, we have to do that with an eye towards promoting diversity. I am such a strong proponent of diversity, equity, and inclusion. This includes diversity for a university, diversity in corporate settings and in businesses, diversity in government, diversity in every organization. I strongly feel that diversity in all of its myriad and wonderful aspects, the beautiful tapestry of diversity that we have in the United States and globally should be not just accepted, but should be welcomed and celebrated for the way that it strengthens and enhances any organization, bringing various viewpoints all to bear in those different settings. So I encourage all of you to embrace and to emphasize diversity in all of your current roles. Now, in addition to diversity, I'd like to talk a little bit about behavioral health challenges. That's another lesson of the pandemic, is the challenges that we face in terms of behavioral health and mental health. So we're all interconnected. The importance of public health, the importance of diversity, equity, and inclusion, and then finally, for my comments today, the issues about behavioral health and mental health. Illnesses, deaths of loved ones, prolonged social isolation as a result of the pandemic have impacted lives across the world. I'm sure you have seen that right here in your Lehigh community and in the Lehigh Valley. These stressors and trauma have had unique implications for substance use trends and mental health trends throughout our nation and, frankly, throughout the world. Our country faces an unprecedented mental health challenge among people of all ages. Communities of color are disproportionately undertreated, even as their burden of illness has continued to rise. Even before the pandemic, rates of depression and anxiety were inching higher, but the grief, trauma, and physical isolation of the pandemic have really driven Americans to the breaking point. Losses from COVID, disruptions to routines and relationships have led to social isolation, to anxiety, learning loss for our youth. More than half of parents express concern over their child's well-being, mental well-being. So in his first State of the Union address, President Biden announced a strategy to address our national mental health crisis. He laid out a vision to transform how mental health is understood, perceived, accessed, treated, and integrated in and out of healthcare settings. So far more now is needed to be able to make sure that everyone who needs help can get help, and they can get help where and when they need it. It is imperative that we promote better pathways to care and make it as easy as possible for Americans with behavioral health needs, including pretty common conditions such as anxiety and depression, to access the resources that they need to improve their mental health and their well-being. We must fight to ensure that every American can access quality mental health and substance use disorder care through their insurance coverage, and integrating mental health services with physical health services. That's actually what I've spent many years in my career doing, first at Mount Sinai and then at the Penn State College of Medicine. My field is pediatrics and adolescent medicine, and what I developed at Penn State was an integrated clinic with medical professionals and mental health professionals to see troubled teens and young adults, particularly those with eating disorders, anorexia nervosa, bulimia nervosa, binge eating disorder, and related conditions, but then other challenged and troubled teens and young adults as well. That's what I did at Penn State. That was the focus of my clinical care, my research, my education, my teaching, and the programs that I developed. So this is an absolutely critical issue in our nation, and we must do better. We can do better, and we will do better. So Secretary Javier Becerra has kicked off a national tour to strengthen mental health in an effort to hear directly from Americans across the country. And that's what I'm doing here today in the various places where I am, to hear from you all, to answer your questions, and to hear what issues you all have in the Lehigh Valley about our mental health challenges, and to engage with local leaders to strengthen the mental health and crisis care system. It's a department-wide effort to address this. So we have under the Secretary's leadership, a Behavioral Health Coordinating Council at the Department of Health and Human Services. I am honored to co-chair that council with Assistant Secretary Delphin Rittman, who's the Assistant Secretary for Mental Health and Substance Use and Director of SAMHSA. And so we have a number of different subcommittees. We're looking at pediatric and adolescent mental health. We truly have a youth mental health crisis. The Surgeon General emphasized that in an advisory last December. We're looking at the overdose crisis, which I'll talk about in a moment. We're looking at that integration between physical and mental health, how to have behavioral health professionals in primary care clinics, in specialty clinics, maybe to embed medical professionals in a mental health clinic. That's actually what my program was. I didn't realize that at the time, but that was sort of what my program was at Penn State. And to use telehealth in its full capacity. And to use everything at our disposal to be able to have people have access. Now, telehealth has expanded a lot during the pandemic, and I think it's been used really well, particularly in the space of mental health. But there are health equity challenges with telehealth. You have to have that device. You have to have either a phone or a computer or a tablet or something to be able to access any type of telehealth services. You have to have means to have a device. You have to have either cellular or broadband service. Well, many areas in Pennsylvania have very poor cellular and broadband service. And so rural areas have a real tough time with telehealth, where actually they might benefit the most from telehealth. So lots of these subtle health disparities exist that we have to address. In terms of the overdose crisis, this is something that I worked a lot on in Pennsylvania. And, we had been making progress. In 2018, 2019, the overdose death rate had been declining in Pennsylvania, in our nation. But with COVID-19 and the stresses of COVID-19, frankly, it's worse than ever. In the 12-month period from November 2020 to November 2021, I think I said that right, 105,000 people died in the United States from an overdose. 105,000 people died of a drug overdose. We're seeing significant challenges from synthetic fentanyl compounds, extremely powerful synthetic fentanyl compounds, but then other compounds as well. I heard about, at a roundtable this morning, about methamphetamine and challenges with methamphetamine in Pennsylvania and in the Lehigh Valley. There's another drug called xylazine, which is showing up. It's an animal anesthetic. It doesn't respond to naloxone, the life-saving medicine naloxone. So challenges continue. So we have a four-part strategy. The first is prevention. We want to emphasize primary prevention, work upstream in terms of prevention efforts, work with the medical community on prevention efforts. We want to emphasize evidence-based harm reduction. Harm reduction including the distribution and administration of naloxone. That was one of the first things I did in 2015 when I became the physician general at that time, as well as fentanyl test strips so people can detect if they have fentanyl. Unfortunately, we're seeing fentanyl pressed into little pills that people might think is oxycodone, might think an opioid, or think as a sleep aid or a stimulant or something like that, but actually it's pure fentanyl, one of these other adulterated compounds. And so people think what they're getting is a prescription drug, but what they're getting is fentanyl, and they die. 40% of the fentanyl pill has a lethal dose of fentanyl. And so harm reduction, fentanyl test strips, and then evidence-based syringe service programs. Worked on that in Pennsylvania. We have Prevention Point in Pittsburgh and in Philly. But illegal in Pennsylvania. They have local ordinances. But although there is a need for syringe service programs in Allentown and Bethlehem, there are no legal syringe service programs in your cities. And so it's really critical that we work on that in Pennsylvania and throughout the nation. And then there's treatment. Particularly medication for opioid use disorder, buprenorphine, methadone, and other medications. But then, there is no medicine for methamphetamine use disorder. So we have to think of other novel treatments like contingency management treatment and others. And then getting people into recovery. So we have a robust strategy on all of these mental health issues, and we really want a mental health transformation. So as I close, I really sort of remind everybody to please continue in your studies or in your research to have compassion and empathy and patience, curiosity and flexibility while you all change the world at your new institute. You're taking a step towards all of that with the creation of this new institute. It's just so fantastic to be here. I look forward to working with you to accelerate the pace of change. So stay connected, stay informed, and stay safe. I'll turn things back to you, Professor. Thank you. Would you like me to sit down or stay at the podium? Stay at the podium.
Thank you very much, Admiral Levine. That was wonderful. Thank you. And now we're going to have a faculty-student panel. So if the faculty and students can join us, just a brief reflections on the
But you want me to stay here?
Yes, if you
All
could,
right.
that'd be great.
Absolutely.
Thank you so much. Thank you. I think this is And we would like to go ahead and just have some brief reflections on your wonderful discussion today. Certainly, you've touched several very important points, and I thought we'd have some faculty and students join us, and then we'll take some questions from the audience.
Great.
And so this is Professor Michael Gusmano in the College of Health.
Thank you.
Why don't we go ahead and introduce ourselves?
Nice to meet you.
I'm
Paulina Gonzalez. I'm an international student from Guatemala, and I'm in the College of Health.
Wonderful.
My name is Sophia Puada. I'm a senior. I have majors in HMS Econ and a global health minor with the College of Health.
Great.
Hello, I'm Kareem Hargrove. I'm a first year student in the College of Health, pursuing a BA in Community and Global Health and minors in Chinese, International Relations, and Philosophy.
None of our students are ambitious.
Oh my goodness.
Thank you so much. So why don't we have a seat and then we can go ahead and take just have some brief comments for a couple of minutes and reflections. And I very much enjoyed your presentation, Admiral Levine, and you hit some wonderful points. And just one, of course, all of what you said is very important. And I think that something you mentioned about telemedicine and the importance of that in a pandemic situation and reaching the rural communities. And I think that as we try to learn about AI and sort of these new innovations in telemedicine, we have to remember that a lot of our rural communities don't have access to this
That's right.
technology. So how do we create policies and ways to sort of address these rural needs? And I think that's very, very critical. And thank you for raising that. So I'd like to pass it over to Professor Guzmano.
Sure, thank you. And Admiral, thank you so much for your wonderful presentation. As you were speaking, you mentioned a number of themes that I think are crucial, I think for the Institute and for the College of Health and for all of us to reflect on. One is the sort of interconnectivity and interdependence of people. The second is information and the importance of good information. And the third is trust. And I would really bring these together and just on a personal reflection, I'm a political scientist by training. The reason I focus on health policy, the reason I'm so proud to be connected with the Institute that my colleague, Professor Gomez, has started, is I think often we think about politics as kind of a dirty word, right? Religion and politics is the thing you're not supposed to talk about at family gatherings. Politics isn't just about nasty partisan politics and partisanship and those sorts of fights. Politics at its best is about how we make decisions, collective decisions about how we're going to live together. And I think the equity concerns that you have raised really do undermine that. So in addition to the fact that we need politics and policy to address equity concerns, if we fail to do this, I think it's one of the things that undermines trust and further undermines our political system and our capacity to work together collectively. And so we try to teach our students about this, get them to think about politics and policy in a somewhat different way, hopefully a healthier way. So thank you so much.
Thank you.
Thank you for your talk as well. And building on that point, like when I first came to the College of Health, when I thought about politics, I was like, there's no change here. Maybe because of my experience with politicians, but like there's nothing to do here. But like hearing people like you talk about like real change, compassion, and how to like correct that mistrust that has built up over the years for minorities like me, like it's really important. And I think like here and you, we can like really make a change together.
Again, just thank you so much for being here today. I guess one of the things that I found really inspiring from just listening to you talk is the emphasis that everyone has a platform. I feel as though, like, especially with the pandemic, you feel small in a sense, and you don't feel like you have a voice. And I think the fact that hearing you emphasize the fact that no matter like where you are, you do have a platform, whether that be through your school community, whether that be through the business professional setting, and even just at like a more local interpersonal level. I think that was truly very inspiring. So I really appreciate it.
Thank you.
Yep.
Again, thank you, Admiral, for being here today. One takeaway I got was the importance of community engagement, especially being here at Lehigh University. I think it's especially important to emphasize the importance of both, forming connections both here at Lehigh, but also within the Bethlehem community, just because I think there is sometimes a disconnect, and really working towards that and working towards building that trust between residents and both Lehigh students, more so through just like the transactional experience, maybe through an internship at a local company or just going into town to do quick shopping, more in depth like volunteering and activities like that, I think are really important, what you touched on in your speech today. So thank you.
Great. Thank you so much, everyone. That was fantastic. We have a couple of questions from the audience now that I'd like to turn over.
Sure.
The first is from Will Stewart, who is a student in a major in population health and is a first year. And his question is, as the U.S. continues fighting the opioid epidemic, where do we draw the line in harm reduction?
So it's a very good question. I think that we have emphasized in the Biden administration harm reduction significantly, and really made it one of the pillars of our strategy, which I think is innovative and creative. I think that it is very important to go to where people are and to treat them the best we can, and where they are in terms of their recovery journey. And so I think that harm reduction is critical. So that is one of the things I did. Again, thinking about harm reduction broadly, with the standing order for naloxone. So naloxone, that was the first state. We were the first state to have a standing order prescription, and now it's common, although not ubiquitous among the states. And so we wanted to make sure that we could increase the distribution and the administration of naloxone. Naloxone is available in a nasal spray, and if someone has an opioid overdose, you can use that, and it will revive them, and then they can get more treatment when they go to the emergency department for more care. It is safe, it is effective, it has virtually no side effects. If someone's unconscious from another reason, it doesn't do any harm. And so it's really the perfect vehicle for this. So we have not maximized our ability to distribute naloxone. Criticisms we took is that it was a crutch, and I absolutely don't think it's a crutch. I think it's a useful tool. I do understand that by itself, it doesn't solve the opioid crisis. But what I said then, as I'll say now, is that, if there's life, there's hope. If someone's alive, then there's hope that they can get treatment and go into recovery. It is impossible to get treatment and to recover if you're dead. And so naloxone simply saves lives, and I deeply feel that if there's life, there is hope for a recovery. So we have to continue to work on that. Fentanyl test strips are new. Because again, what people think they might be getting, it's fentanyl. So synthetic fentanyl compounds, they're made in a laboratory. The opioid crisis has gone through several stages, and what we're seeing now is this emphasis on cheap, easy to make fentanyl that is primarily being made from chemicals that are sent through China, eventually find their way to cartels, primarily in Mexico, and then flood the United States. And what they're doing now is they're pressing it into little pills. They're absolutely dirt cheap to make, and they do an incredible profit. So unfortunately, many people, including many young people, we had one of the highest overdose death rates in teenagers this year they've ever seen, even though actually addiction rates, drug use rates are not higher. It's that kids are buying pills on the street that they think might be, a sleep aid, or they think is Adderall, or they think is, help them with a test or whatever, although it doesn't. And they overdose and they die from synthetic fentanyl compounds. So it is absolutely a tragedy. But we're seeing, adulteration of other drugs like methamphetamine and things like that. So it's an ever-evolving situation. I've met with Dr. Gupta at ONDCP, the Office of National Drug Control Policy. I've met with Director Milgram of the DEA. I mean, everyone's really trying to address this. There is, of course, a strong law enforcement interdiction aspect. That's just not my aspect, but they are working on that. And then we're working on the public health aspects. Syringe service programs. I would love to tell you that syringe service programs are new. They are not. They've been around in Pennsylvania for like 30, 35 years at prevention points in Philadelphia and Pittsburgh. They really address the syndemic, which means that the multiple things at the same time of increasing of HIV, hepatitis, and drug overdoses from injectable drugs. And so syringe service programs, I think, are key throughout the nation. Syringe service programs, again, are illegal in Pennsylvania. They only exist in Philly and Pittsburgh because of local action. And so what we were trying to do before we left was to get syringe programs to be approved, and then have syringe service programs here in Bethlehem and Allentown, in Reading, in York, in Lancaster, in Altoona, in Erie, not just in Philly and Pittsburgh. But that work continues, and that work continues across the nation. But I think syringe service programs are very, very important. What everyone asks me about are overdose prevention sites, or quote unquote safe injection sites. So, they have not been studied in the United States. They have been effective in Canada. in certain large cities like Vancouver. They have been effective in parts of Europe. We have challenges that Canada and Europe don't have in terms of the number of people we have in the United States and the diversity of experiences we have in the United States. New York has drawn a line in the sand, and they have an overdose prevention site now in New York, and so we'd love to study it. And I know that NIDA has plans to get data, National Institute of Drug Abuse, to study it, and then maybe after study and data that support them, maybe things will change. So to be continued.
Our next question is from Genevieve Gwalik, who is a student and an HMS major, a junior. The question is, in the wake of COVID-19 and new challenges faced in the wake of globalization, how might educational systems adjust their curriculum to support improved health equity and health literacy?
I might give that one to you, since you're running the institute. I think that it is very, again, the COVID-19 has shown us the critical importance of public health, which has been under-resourced, undervalued, under-resourced, undermanned for decades. And so public health obviously is critically important at all levels, at the local, state, federal, and international level, and we all have to the best of our ability work together. I think that I would like to think that that's not a new concept, but I think that that's one of the things that we've learned during the COVID-19 pandemic. We need more students like many of you that are studying all these different aspects of health policy and politics and public health. We need medical students to learn more about public health. We need nurses to know more about public health. We need other health professionals, whether they're pharmacists or nurse practitioners, to learn more about public health, because we can see with the pandemic how critical that knowledge has been, and to be able to critically look at public health recommendations and to be able to understand why they're being put forth like that, and then to be able to critically look at them and then to promote them through the community. So I think that public health is the center of the universe. I used to say that Brooklyn was the center of the universe, but I think it's public health right now is the center of the universe. So you could not be in a better place than this institute in terms of the needs of our nation and the needs of the world. It certainly has taught us that we are global. We are global. Even with forces that are trying to make us more provincial and more regional, we are actually quite global. And you can see that with how COVID-19 has spread. And so we need to think globally on many different aspects. And I'll throw out a new topic, if I can, is a new office that's in on the Office of the Assistant Secretary is our Office of Climate Change and Health Equity. We face climate change threats, environmental threats like never before. We have to have that environmental justice view, that lens, that health equity lens to it, because it's the same communities that suffer from other health disparities that are suffering from disparities due to climate change. We not only have heat emergencies in Phoenix. I was in Seattle and talked to the doctors there. They had a heat emergency in Seattle. Well, most people don't have air conditioning in Seattle. And if you have means, then you can go buy an air conditioner. But if you don't have means, then you swelter. And they had many, many seniors, some who tragically died and had to be seen in the emergency department for heat stroke and for dehydration. We see the fires in the West. Other parts of the world as well, that also generates smoke that can exacerbate asthma and other respiratory conditions. Sea level rise, weather changes and storms stoked by climate change that hit vulnerable, disadvantaged populations. So a new Office of Climate Change and Health Equity. Now in 2022, our Congress gave us no money for that Office of Climate Change and Health Equity. We asked for $3 million, which sounds like a lot of money, but actually in the scope of the federal government, it isn't that much money. And we got zero. So we are continuing to work with Congress and other ways to try to get money to continue that office, and we will continue that office no matter what, but we can do more if we have any funding. And then we'll hope in 2023 to get funding. So climate change is here, and the impacts of climate change are not for future generations, it's for people right now. And so another demonstration of the need for those type of issues.
Thank you very much, Admiral Levine. Our next question is from Lucy, who is a student in global studies. In your view, what have some of the most impactful policy shifts on LGBTQ rights and under the Biden administration, especially from HHS?
Sure. Well, thank you for that question, because this goes back to health equity. Excuse me, health equity. I'm just going to take a little drink. And it involves health equity for another disadvantaged community, which is the LGBTQI plus community. I believe you know what that means, right? Lesbian, gay, bisexual, transgender, queer and questioning. I is intersex, and then plus for others on the rainbow, so to speak. Have long suffered health disparities. We had made progress in the Obama administration with a number of different initiatives. We lost a significant amount of ground in the previous administration, and we are literally building back better, as the president says, in terms of these policies. So at HHS, one of the specific policies that our Office of Civil Rights has enacted and is developing regulations for is that Section 1557 of the Affordable Care Act states that you cannot discriminate on the basis of sex. So it is our interpretation that that includes sexual orientation and gender identity. And that will be promulgated into rules and regulation, and then that will inform everything that we're doing, including the actions of CMS, the Center, a lot of acronyms in the federal government, CMS, the Center for Medicare and Medicaid Services in terms of insurance coverage, but also HRSA, the Health Resource Services Administration, in terms of the community health centers and providing care. So, you know, there is also Title IX in terms of equal opportunity, which includes sexual orientation and gender identity. And that's involved with the Department of Health and Human Services, but also the Department of Education in terms of policies in schools and colleges. Title IX impacts much that happens on universities and as well as in other schools. So we're going to have many different actions throughout the Biden administration on this. What we're facing is a backlash. We're facing a significant backlash in the states who are passing laws and developing actions and policies that are extremely discriminatory against LGBTQI plus individuals. So one example would be the quote unquote "Don't Say Gay" law in Florida. You know, studies show that one supportive adult for an LGBTQI plus kid can make all the difference in terms of preventing suicide, in terms of them being able to navigate the world and to adulthood and leading a happy, successful, productive life. One supportive adult. I'd love if that was always the parent, but it's not always a parent. Frequently it's a teacher or a guidance counselor or some other coach or another school personnel. This law forbids kids essentially from talking to these people. And also it means that if you tell a teacher, the teacher has to tell the parent. And so it really is a gag rule. It's a gag law to help to prevent kids from accessing supportive adults. In addition, Florida and other states are taking actions and writing laws that prevent trans kids and gender diverse kids from participating in sports or activities. It is actually preventing them from accessing gender affirmation treatment, psychological treatment, and medical treatment, often at our expert children's hospitals. The action in Texas would mean that if a parent was seeking that treatment for the young person, that they could be guilty of child abuse and have their child taken away. Recently in Alabama and other states are considering this, if you're a physician that provides gender affirming care, that is a felony now in Alabama. So these laws are discriminatory, they are egregious, and they're going to cost lives. And so I think it is incumbent upon all of us to stand up and take action and to speak out against these laws which are going to cost kids lives. Trans kids are vulnerable. They are at mercy of being harassed and bullied and suffering discrimination. They need to be supported. They need to be affirmed. They need to be empowered. One supportive adult can make all the difference. And so when they see these laws that basically are trying to erase them, then that costs lives. And so I think it's incumbent upon all of us to stand up. I have been and will continue to stand up. I'm going to Texas on Saturday to stand up and to talk against these laws, and encourage all of you to do as well. I mean, it really is going to take all of us to fight against this politically motivated discriminatory actions and laws. Thank you.
Thank you very much. Thank you very much, Secretary Levine. That's
Thank you.
wonderful. Completely agree. Unfortunately, we have run out of time, everyone. The Secretary has a very, very tight schedule today. But thank you so much. It's certainly been an honor for you to join
Thank you.
us for our first event. I'm so honored to have you here with us today. Hoping that you will return again in the
Absolutely.
near future. And thank you, everyone, for taking the time today. Thank you very much.
Thank you very much. Appreciate it. Thank you. Thank you. Thank you so much.